Welcome to our education session about treatment options for advanced chronic kidney disease. This is Dr. Kadri, and I will be your narrator. In this presentation, we will go over the treatment options available to patients with very advanced chronic kidney disease in order to replace their kidney function when it becomes necessary. These include dialysis, which can be done at home, and both peritoneal dialysis and home hemodialysis will be discussed as home therapy options. In addition, dialysis can be done in a hospital-based setting. We will also discuss the option of kidney transplantation, as well as conservative treatment, early decision-making, and early body access for renal replacement therapy guarantee the modality of your choice with safe and timely renal replacement to avoid potential complications. Dialysis is a form of renal replacement therapy for advanced chronic kidney disease. It helps replace some of the function that healthy kidneys would normally perform, such as filtering waste products and removing fluid from your bloodstream and body. Dialysis does not cure kidney disease. Once it is necessary, it is often a long-term treatment that can allow you to live a very productive and healthy life. There are two types of dialysis: peritoneal dialysis and hemodialysis. We will begin by talking about peritoneal dialysis. Peritoneal dialysis is a simple and gentle form of daily dialysis done within your home. This type of dialysis is performed inside the body and uses the lining of your abdominal wall to filter your blood. This lining is called the peritoneal membrane, and it acts as the artificial kidney or filtering system. In order to do peritoneal dialysis, access to the peritoneal cavity inside of your abdomen is needed. To do this, a catheter or thin tube is inserted into the abdomen. This allows fluid to be carried in and out of the abdominal cavity or peritoneum. Once a peritoneal dialysis catheter is in place and dialysis is deemed necessary, fluid can be put into the abdominal cavity through the catheter, either manually or by the use of a machine. This fluid dwells inside the abdominal cavity, and dialysis occurs across the peritoneal membrane, allowing substances in your blood to be filtered, including waste products and fluid. After a certain length of time, the fluid in the abdomen is drained through the same catheter, and dialysis has occurred. The solution that is instilled into the abdominal cavity through the catheter is a sterile solution called the dialysate. This helps to pull wastes and extra fluid from the body into the abdominal cavity. These wastes and fluid then leave your body once the dialysate solution is drained after a set period of time. The process of draining and filling is called an exchange, and this takes about 30 to 40 minutes to perform. Peritoneal dialysis is a preferred dialysis option as it allows a patient after training to stay within their own home, but may not be for everyone. There are two types of peritoneal dialysis. Continuous ambulatory peritoneal dialysis, or CAPD, is a process by which exchanges are done manually usually 4 times per day. Each exchange takes approximately 30 to 40 minutes. Alternatively, automated peritoneal dialysis, or APD, occurs when exchanges are done using a machine. This is generally done overnight while you sleep, and 4 to 5 exchanges are done during this time period. This allows patients to have a relatively free daytime period, yet still achieve the process of peritoneal dialysis. As mentioned, both CAPD and APD allow patients to perform their dialysis in their own home after a training period is completed. After training how to do manual CAPD exchanges, most patients prefer to switch to automated peritoneal dialysis, or APD. This allows the use of a machine called a cycler to perform exchanges automatically while you sleep. As mentioned, this allows significantly more uninterrupted time during the day for work, family, and social activities. The advantages of peritoneal dialysis are numerous. In general, it offers more control and flexibility of your free time. This most often leads to a greater sense of independence. Peritoneal dialysis can be done at home, but it can also be done at work or on vacation relatively easily. In general, patients on peritoneal dialysis can have a more relaxed diet and, generally speaking, do not need to follow strict fluid restrictions. Although the complications of peritoneal dialysis are rare, most can be prevented or easily managed. These may include infection, weight gain, or abdominal hernias. Now let's talk about the second type of dialysis, called hemodialysis. Hemodialysis is a procedure that is performed to artificially replace your kidney function. Hemo means blood, and dialysis means to clean. This type of treatment is generally a 3.5 to 4.5 hour treatment required 3 times weekly. It is a long-term treatment in most cases that can allow you to feel better and continue to enjoy a good quality of life. Hemodialysis requires direct access to your bloodstream. This access can be through an AV fistula or graft in a patient's arm or through a central venous catheter. These will be explained later. Once blood is accessed, it is sent to the dialysis machine for cleansing. Blood goes into a dialyzer, which essentially acts as an artificial kidney, where fluid and waste products are removed. Filtered or clean blood is then returned back to the patient through the same dialysis access. With hemodialysis, there are some important points that you would need to know. The amount of dialysis that you need depends on your body mass, and that determines, generally speaking, how much waste you will have in your blood. It also depends on how much fluid weight you gain in between treatments. Complications on hemodialysis can usually be prevented or easily managed. Some of the complications may include low blood pressure, muscle cramping, or possible infections. As mentioned earlier, hemodialysis requires direct access to your bloodstream. This can be through an AV fistula, which is a permanent form of access created surgically by connecting an artery to a vein in your arm. This is a relatively simple procedure. An AV graft is also another form of permanent access, but this uses a synthetic tube implanted under your skin in your arm, and this is generally needed when your veins are very small. A central venous catheter is an artificial tube most often used as a temporary access when a fistula or a graft is not available or not ready for use. Generally speaking, an AV fistula is the preferred method for long-term use in hemodialysis patients, as it generally affords patients better dialysis with less complications. The type of access you will have depends on your blood vessel anatomy, as well as how quickly you need to begin dialysis. Early decision-making can avoid emergency catheter insertion. This is a diagram of an AV fistula. With a relatively simple procedure, an artery and a vein in your arm are connected. This allows access to your bloodstream to perform hemodialysis. This is generally a procedure performed on an outpatient basis. Once completed, the AV fistula takes about 6 to 8 weeks to fully mature and to be ready to be used for dialysis therapy. This is a diagram of an AV graft. This is where a synthetic tube is placed under the skin connecting the artery to the vein in your arm to allow access for hemodialysis. This is also a relatively simple procedure for patients who have very small veins. This is a diagram of a central venous catheter. A central venous catheter is an artificial tube that goes through the skin in your chest wall into a large vein in your neck that leads down into your heart. This can be done on a relatively urgent basis in order to perform emergency dialysis. This is generally a temporary form of dialysis access, as an AV fistula or AV graft is still the preferred form of access. This is mainly due to a lower risk of infection and other complications. And generally speaking, an AV fistula can often lead to better blood cleansing on dialysis. An AV fistula remains the preferred method of dialysis access where possible. It is underneath the skin with no synthetic material exposed to the outside world. They generally last the longest out of all the types of dialysis access, with fewer infections, complications, and need for hospitalizations. Now, it may not be possible for all patients to initiate dialysis with an AV fistula. Sometimes an AV fistula does not mature or develop properly after insertion. It generally takes about 4 to 6 weeks before it is functional. In rare cases, it can inhibit circulation to the hand after placement. A central venous catheter is used for dialysis access when the need for dialysis is relatively urgent, or an AV fistula is not in place at the time dialysis is needed, or if the patient is not a candidate for an AV fistula. Although not preferred for most patients, it is still a safe and effective way to perform dialysis. The advantages of a central venous catheter include that it is a fairly simple and quick procedure. It can be used immediately after placement. There are no needles involved with dialysis. But in general, they do not last as long as an AV fistula or graft, and they have a higher infection rate, which can be serious at times if the infection gets into a patient's bloodstream. This can lead to more hospitalizations. There is a higher risk of clotting, which may require intervention by way of a procedure in radiology. In addition to that, a central venous catheter can injure important veins that later may be necessary to have a properly functioning AV fistula. Overall, however, despite these drawbacks, many people dialyze with a central venous catheter in a safe and effective way. It is important to note that both peritoneal dialysis and hemodialysis can be done at home. Now I'd like to talk about home hemodialysis. Home hemodialysis is when a patient administers their hemodialysis treatment in their own home after appropriate training. If you have determined, with the help of your healthcare team, that home dialysis is right for you, you will begin a comprehensive safety program that is tailored to your specific medical and learning needs. In many cases, a care partner can be trained as well to assist you during your treatments. Why do people choose home hemodialysis? Well, there are many answers to this question. It is important for each patient to find a treatment that fits your lifestyle and maintains your quality of life. In the case of home hemodialysis, just as for peritoneal dialysis, you can perform dialysis in the comfort and privacy of your own home. This allows the treatment to be more flexible around work and family schedules to keep your freedom relatively intact. In addition, home hemodialysis patients can receive more dialysis and better clearance of toxins that can subsequently make patients feel better. Home hemodialysis allows for flexibility in the type of dialysis a patient performs at home. There is the option of conventional dialysis, where the patient performs dialysis 3 days per week at home for an average of 4 hours each treatment. There is also the option of short daily hemodialysis, where dialysis is done 5 or 6 days per week, typically lasting 2 to 3 hours per session. Some patients perform nocturnal hemodialysis, where dialysis is performed 3 or more nights per week, typically for 6 to 8 hours while sleeping. This allows much more freedom during daytime hours. Now let's talk about kidney transplantation. This is also another form of renal replacement therapy for patients with advanced chronic kidney disease. With a kidney transplant, the new kidney that's transplanted into a patient with chronic kidney disease performs the functions of your non-functioning kidneys. Only one donated kidney is needed to replace the work previously done by your own kidneys. A surgeon places a new kidney into your lower abdomen and connects it to vital blood vessels as well as to your bladder. This surgery takes about 3 hours to perform. Remember that every operation has some risks, and these will be explained to you in detail by the transplant team. This is a diagram of where a donor kidney would normally be placed. Patients who receive a kidney transplant can have their kidney function, in most cases, return to normal or very near normal levels, assuming there are no complications. Fortunately, the complications of a kidney transplant are not common. They can occur, however, in some patients, and it is important to be aware of the risks. There are many different types of possible donors when it comes to kidney transplants. A living related donor may be a family member, such as a parent, sibling, or child. A living unrelated donor may be a spouse or a friend. In instances where a donor and recipient are incompatible, it is possible to do a paired donor exchange. This is essentially where incompatible donors and recipients swap donor kidneys to increase compatibility and chances of success for kidney transplantation. A deceased donor is when the donor comes from a person who has recently died of causes unrelated to kidney disease. After a kidney transplant, to avoid rejection, immunosuppressive therapy is needed. This is medication that needs to be taken daily to suppress your immune system to keep your transplant kidney working well and keep you off of dialysis. Although this treatment helps prevent rejection of the transplant kidney, it also puts patients at slightly higher risk of infection and cancer. A kidney transplant may offer the best chance of returning to a more normal lifestyle. However, not everyone is a suitable candidate. Success rates are generally very good, averaging around 85 to 95%. However, prior to undergoing a kidney transplant, every patient should be aware of both the benefits and the risks. For some patients with advanced chronic kidney disease, dialysis or kidney transplantation may not be their desired form of treatment. In these cases, conservative treatment or palliative care may be the best option. This is a treatment plan that would honor a patient's wishes if they decided to let the natural history of chronic kidney disease run its course without replacing kidney function. It is important to note that everyone has the right to choose conservative treatment if you feel that this is best for you. It is important to discuss your feelings fully and openly with your nephrologist and family members. During your journey through advanced chronic kidney disease, you may be asked to make some difficult decisions. Remember that getting all the appropriate information and education is very important in decision making. And keep in mind that often the most difficult steps are the first few that you have to take in order to get to your final destination. I hope that you've found this useful as an aid to decision making in your journey through chronic kidney disease. This program has been supported by the Care for Kidneys Foundation.